I have a stopped penis. I'm uncircumcised, and sometimes I find it very difficult to pull back the foreskin. Hello, everyone. Welcome back. I'm Gwendolyn, your seasoned medical microbiologist. If you are watching and you have been watching and you haven't smashed that subscribe button and turned on that notification bell, please show me love by doing so. And please don't forget to share with a friend so they get empowered. What are we waiting for? Let's roll in. A stopped penis, also known as phimosis, is the inability or difficulty to retract the foreskin backwards. Phimosis, also known as a stopped penis, occurs in most males that are uncircumcised. It's normal for a baby, a toddler, to experience this. It's normal to a certain age. And when they start reaching like 5 years old, 6 years old, it becomes abnormal. But it's abnormal for an adult to be experiencing a stopped penis. So if you have a boy and at the age of 5, 6, he's experiencing a stopped penis, please take him to the hospital. Causes of phimosis. Number 1, forceful retraction can cause phimosis. When you try to pull back the foreskin so rapidly, forcefully, it can actually get stopped. Number 2, autoimmune diseases. There are some autoimmune diseases that causes phimosis. Number 3, recurrent infections. And in this case, we're talking about fungal infections, bacterial infections that affect the penis or the cap of the penis. And the fourth and the most common cause is the accumulation of smegma underneath the foreskin. And what is smegma? Smegma is the accumulation of sebum, that's the natural oils produced by our skin, with dead skin cells and sweat and other debris and traces of elements or of substances on our skin or on particular areas. And on this case, we're talking about underneath the foreskin. What are the complications with phimosis? It causes pain during erection, serious complications when a man wants to have an erection. He will begin to feel pain at the tip of his penis. Number 2, problems while urinating. Refracting or pulling back the foreskin to pee will be a problem. Number 3, most common complication is recurrent urinary tract infections. Because of the accumulation of smegma underneath the foreskin, it forms a very healthy medium for the growth of microorganisms and most commonly fungus and bacteria. So all the time you will have these microorganisms traveling in through the urethra to the man's bladder. Now, phimosis is one of the number 1 cause of vaginal infections, recurring vaginal infections in women. When a man has phimosis, balanitis, paraphimosis, he has an 80% chance or 90% chance of causing recurrent vaginal infections in his spouse, in his partner. So if you are a male and you are uncircumcised, you owe it not only to yourself but to your spouse and for the health of that relationship to be hygienic, because the accumulation of smegma is caused by inhygiene. And I've spoken about this severally on my videos. I did a video on how unclean penises cause vaginal infections and also how genital odors are being caused. And I think you should watch those videos so you get empowered. The last complication with phimosis is it can lead to paraphimosis. And what is paraphimosis and how does it manifest? Paraphimosis is when the foreskin becomes so tight that it prevents blood from flowing back to the end of the penis. That means the tip of the penis, the area of the foreskin, becomes so swollen that blood doesn't flow back to the end of the penis. And this can cause erectile dysfunction in males. So, as a man, you owe it not only to yourself, but also to your partner to wash properly, especially if you are uncircumcised or you haven't been circumcised rightly. There are some men that the circumcision was poorly done and they are stuck with it, and they experience phimosis, a stuck skin, or paraphimosis, and also balanitis. So it's important that you clean up yourself properly. You always pull back your foreskin and you wash properly. What is the treatment for paraphimosis or phimosis? Like when the foreskin becomes stuck. You go to your doctors, your urologist, or your GP, and you ask them for a cream. They're going to prescribe you a steroid cream that will help you with the inflammation. You will need to apply it daily, morning and evening. You pull back the foreskin and you apply it there. And it's going to help with the swelling, with any form of inflammation or redness around that area. If you're having bacterial infections, rashes around that area, you'll be given an antibiotics. If you have a fungal infection, you'll be given maybe Nystatin, ketoconazole, depending on what the doctor wants to give you at that time, or depending on the degree of paraphimosis or phimosis. Now, if you have used these steroid creams, these antibiotics, these antifungal creams or medications that have been prescribed to you rightly as the doctor did, and you're still experiencing it after a month, I think you should see your doctor again and request to be circumcised. Request to be circumcised. If you have been poorly circumcised, if you're uncircumcised, please request to be circumcised, because you would end up having this problem again and again. And paraphimosis is very painful. Phimosis is quite painful, especially when you want to have an erection. It will really affect your sexual life. And if you're married, your spouse is not really going to have a healthy sex life with you. The thought of always having infections, the thought of you always being in pain during intimacy will affect your level of climax, your level of your stamina, your sex drive, your desire, your libido, and also that of your spouse. So, thank you for joining me into this class. I remain your seasoned medical professional.